welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about some efforts of the state capitol to guarantee sick leave for California workers. My guest in the segment is Lorena Gonzalez, who is a member of the State Assembly from South San Diego. Thanks for being with us.
Thanks for having me, Steve.
You know, I think so many of us take sick leave for granted because most of us get it at our workplace, but there are a lot of Californians who don't.
There are about 6 million Californians who right now don't have any kind of earned sick leave, and that's really about 70 to 80% of low-wage hourly workers. So yeah, there's a whole lot of workers out there who have never had the opportunity to take a day off if they're sick, or to take their kids to the doctor, or stay home with them if they're sick.
A lot of these workers, they're in the food service industry, for example, or nursing.
For food service, retail, a lot of our child care providers, and our providers for seniors are the bulk of the workers who would be affected by this bill.
And your issue, I guess, is twofold, I suppose. I mean, one is these workers, there are times when they need time off, either for their personal illness or someone else in the family, for example, but also a lot of times they end up going to work sick because they need the money and they need to keep their job.
You know, there are multiple reasons why we should pass this bill, but one, like you said, is right. It's what's humane and just. When people are sick, they should be able to not have to choose between whether they're going to pay the bills that month or stay home sick. Not excessively, but you know, we're talking 3 days for the entire year is what we're trying to guarantee. But it's also a cost, obviously, in terms of public health. We have a lot of waiters and waitresses who go to work sick, unfortunately, and we know, like in this flu season, how dangerous that can be. And it's also a cost to emergency room care. We are finding that there would be a huge savings if individuals who are sick weren't utilizing the emergency room, instead could go to the doctor during the daytime. And so we think that there will be a huge shift of cost, which will benefit all of California.
Also lost productivity.
Absolutely, you know, presenteeism, and that's the term they use when people show up but aren't feeling well, really does reduce productivity in the workplace. And so we think it's good for employers, it's good for the community in terms of public health and the cost to emergency room care, and of course it's good for the worker.
So your bill would provide 3 days a year, which isn't much, but it's something.
Right. It's it would allow the worker to earn 3 days. Basically, they'd have to be employed for 90 days, so like 3 months before they could use any time. And during that time, though, they would be earning for every 30 hours they work up to an hour of sick leave. So with a cap of 3 days.
The bill is recently introduced, has not been heard in any committee yet, so there's been no debate, no public debate. But I certainly would imagine that some of the small businesses in California would try to fight this, because they basically say this would increase their costs, and those costs they would then have to pass on to the consumers. Well,
you know, it hasn't been debated this year, but Fiona Ma had carried this bill for about 6 years when she was in the legislature, and so we have heard all those arguments. We've toned down the bill increasingly. It used to be at 5 days and 7 days, and it's now down to 3 days. But we have examples. The state of Connecticut passed this, and after the fact, the businesses say it's working out well. San Francisco has paid sick days, and that works out well. So we have some actual real-life examples of businesses who have been operating under this system for quite some time now, and say actually it turned out to be a pretty good situation for both their employee morale as well as for productivity.
Are you negotiating with the business community now, or with chambers of commerce?
They haven't come in and asked me to negotiate. 3 days is, I really am one of those negotiators that come with exactly how far I'm going to go, and 3 days is as low as any bill that's ever been introduced on paid sick leave in any jurisdiction, city, state. So I think we're presenting what we'd like to see.
All right. Well, we're out of time, but Lorena Gonzalez, a member of the State Assembly from South San Diego, thank you very much for coming by and talking about this very interesting issue. We appreciate it.
Thanks, Steve. Thanks for having me.
And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on YouTube, also on My Government On Demand. Have a great day.